Hello guys, whenever I will get time I will be discussing some of the topics in the pharma dose, an important MCQ. So today I am going to which of the following is not used in congestive heart failure? Options are A. Metoprolol, B. Sacubitril, C. Nesiritide, D. Trimetazidine. So the answer is Trimetazidine. So this drug is an anti-anginal drug and it is not used in congestive heart failure. Now if you take one by one, beta blockers, they are contraindicated in acute or decompensated heart failure, but they can be used in compensated or chronic heart failure where patients are stable. We can use beta blocker starting with lowest dose and increasing it slowly. Approved beta blockers are carvedilol, metoprolol, bisoprolol. So they should be started at lowest dose and the dose should be increased slowly. So what they do, they reduce adverse effect of sympathetic overdrive over the heart and they prevent pathological left ventricle remodeling. So these two are the uses of beta blockers and they are used in low dose. High dose will uh, affect the heart adversely by exerting negative inotropic effect. And once started, they should not be stopped abruptly, otherwise, it can have adverse consequences. Another drug is sacubitril. So, this is a neprilysin inhibitor. Neprilysin is an endogenous neutral endopeptidase which metabolizes vasoactive peptides like natriuretic peptides and bradykinin. So thus, by inhibiting this enzyme, the level of these peptides will increase and these peptides will cause reduced vasoconstriction and reduced sodium retention. So these effects are beneficial in congestive heart failure. So this drug can be used in congestive heart failure. Now another important group of drugs which is a newer group is ARNI drugs. This is a combination of angiotensin receptor blocker, valsartan and neprilysin inhibitor in which sacubitril is there. So it is a combination of valsartan and sacubitril. This is a fixed dose combination and it is used in resistant heart failure. The third option was Nesiritide. So this is a recombinant form of human B type brain natriuretic peptide that has beneficial vasodilatory, natriuretic, diuretic effects. So this peptide causes loss of sodium, vasodilation and diuresis. So all effects are beneficial in congestive heart failure. So this drug can be used in congestive heart failure. Can be given intravenous for the management of patients with decompensated CHF. Next is the drug which cannot be used in trimetazidine is trimetazidine in CHF. It is a metabolic modulator, inhibits beta oxidation of fatty acids, and it shifts the metabolism to glucose. Metabolism of heart muscles is shifted from fatty acids to glucose. So this requires less oxygen. So oxygen requirement of heart decreases. So this effect is beneficial in patients of angina and it gives them relief. And this drug is used in angina pectoris, not in CHF. So the answer of the question is trimetazidine. It is anti-anginal drug.